What are some of the clinical predictors for relapse in myeloma, and when should patients speak up?
Okay, so when we say clinical predictors of relapse, well, let me look at this from the standpoint of a patient's been diagnosed, they've been treated. Which patients are more likely to relapse is one way of looking at. And if we are looking for or following up a patient, what are we monitoring to look for relapse? So I'll address both of these very quickly. So when we say what are the predictors of earlier relapse, the most important things that we know of are one, any of the high-risk mutations. We've been talking about the fact that it's standard of care to look for any genetic mutations in the diseased plasma cells, the myeloma cells. Presence of any high-risk mutations, for example, there's one called deletion 17p. So certain chromosome 14 mutations like 14, 16 translocation, etc. Patients should be aware of what mutations their plasma cells have. Having high-risk mutations, risk of early relapse or short duration of response. Similarly, if a patient does not get a deep response to their prior treatment, they are more likely to come out of that response state sooner. One of the tests that has recently been used over the past few years is something called the MRD test, minimal residual disease test, looking for one myeloma cell out of 100,000 or even 1 million bone marrow cells. If somebody is MRD negative, they are more likely to have longer duration of response. If they're MRD positive, meaning detectable disease on MRD test, comparatively shorter duration of response, etc. So these are predictors of earlier relapse. There are some other predictors like kidney dysfunction, and typically that happens if somebody has persistent kidney dysfunction because they don't typically get access to all the drugs. Typically relapses occur sooner. Now, when somebody is getting monitored for their disease, as I mentioned, we do labs ever so frequently, every month, every 2 months, every 3 months. That is what involves all the myeloma markers. Serum protein electrophoresis to look for M spike, serum free light chains to look for light chain changes, serum immunoglobulins to look for increases in immunoglobulins. And that's what helps pick up the recurrence of the disease.